What are the most challenging cases you deal with?
That's a great question. In my work for Children's Aid, I have seen some of the most horrific cases of child abuse possible. It's terrifying, it's horrible, but it's my job. I've got to be able to compartmentalize it. I need to have enough compassion for the family to be able to really hear the story, to get all sides to it, and to do the best job for that family. But I'm not, I can't take it home with me. And the same applies in my therapy cases, because some of the patients that I see do have histories that are consistent with the Children's Aid cases that I deal with. In those cases, I'm just assessing the parents and maybe the family in a short term and then writing up about it. With a patient, I'm seeing them maybe weekly for months, if not years. And so, some really terrible cases of abuse, neglect, just some real, the things that movies are made of. And a lot of times you wouldn't even write a movie about it because it seems too unreal. I've had a number of these cases. So these are very difficult, but not for me. But it's just understanding that this person, no matter how bad my day is, it's never going to be as terrible as the nightmare that they're living 24/7. And and I express to my clients, the ones who have this kind of history, I say with the utmost respect, I don't know how you do it. That's incredible. And most people don't even know their stories because they've learned from a long time not to open up, not to reveal the secrets of the family. So they're somehow keeping it all locked inside, and people don't know this, that they're just they're carrying around these shameful or these very hurtful experiences. So these are sometimes the most difficult case because it's difficult for the client themselves to be able to open up and be able to to confront these things and to try to convince somebody that really, believe it or not, it's better to be able to do that, because then you actually have a better sense of reality. Then you are reclaiming part of who you are. And I tell my clients, if I had a magic pill that would make you forget everything in the past, I'd love to give it to you, because who would want to relive this? Who wants to confront these horrors that you spent so long trying to keep aside? But the reality is, many of my clients in their 20s, 30s, 50s even, they're starting to have memories resurface. Sometimes they're little memories, sometimes their whole childhoods that had been completely repressed, that they didn't want to deal with back then, and now it's hitting them today, and they don't even know what's going on. They're wondering why someone says hello and they're getting triggered like that, because they didn't know that certain tone or inflection is reminding them of something that happened to them before. So it is a real tough sell, and as I say to them, once that crack has started to appear, the memories, the images, the feelings, they're starting to seep out. And, we can try to seal it, but it doesn't usually work. So it's really hard to work with them to deal with the damaging experience that they've been dealing with for so many years, and help them, confront it in a realistic manner.